Thank you for coming.
Thank you. Thank you for having me. Dr. Patel, I graduated from Salish University down the road about, May is going to be 11 years.
Oh, wow.
Yeah. You have to think about it sometimes. But, yeah, so,
Pay attention.
I've been doing this for a while. I, worked for other people first. I worked for lens crafters, and then I recently just bought Wink, Eye Care and Optical. Like she said, it's up the road in the new Metaplex building. And I'm the optometrist and the owner there. And so I see a wide range of patients. I start at 5 and then up to whatever age. I also treat glaucoma, manage macular degeneration up to the point that I can, because after some point, sometimes some people need surgery and injections, which optometrists don't do, then you need to go to an ophthalmologist for that. So I'd like to today speak about macular degeneration.
You can take your mask off.
Oh, okay.
Yeah.
Today I'd like to speak about macular degeneration. It is the leading cause of vision loss. About 10 million Americans have it, and it's more prevalent than glaucoma and cataracts combined. Macular degeneration is mainly hereditary, but there's a lot of external factors that can make it worse, which I'll go over later in the presentation. What happens in macular degeneration, just to give you a high level before I go into the details, is that it affects the central portion of our eyes. So it's called the macula. The macula gives us our central crisp vision and our ability to see color. So everything in the center of our vision, when you have macular degeneration, depending on what stage, can be blurry to just a very big black spot to a blind spot. So macular degeneration, so this gives you just a little, this has a little animation on how it kind of progresses, but so the image isn't received correctly into the macula because, again, the cells that are in the macula are affected by macular degeneration. What basically happens is that our system, our bodies have a way to get rid of waste, right? Everything. There's a lymphatic system, there's every organ has a way to get rid of waste, so does the eye. So what happens is that the recycling system inside our eyes doesn't work as well because something genetically got triggered and it's not recycling all of our waste products. So those waste products accumulate in the macular area, causing, again, I'll show you later, what we call drusen. And that's what kind of accumulates, and that's the definition of macular degeneration. So the waste doesn't get removed like it's supposed to. Those antibodies, antioxidants don't come and remove the waste as needed. So there's two types of macular degeneration. There's the dry kind and the wet kind. The dry kind is more prevalent. It's about 85 to 95% of the population. And then that dry kind can turn into wet, which is about 10 to 15% of the population. So it's rare to have the wet, but it can progress to the wet kind of macular degeneration.
The wet is worse?
Wet is worse, yes. So the dry macular degeneration, as illustrated in the picture there, again, it's accumulation of drusen. Drusen is basically waste product. So you'll see drusen in two different types. The type that we see there is the soft kind, and then there's something called hard or pinpoint drusen as well. So when you see the soft kind, again, as depicted in the picture, that tends to accumulate and grow at a little bit of a faster rate. And it takes up spots in the macula, causes blind spots, and again, it's the waste product that's not being taken away. And then you'll see there's the wet kind, wet macular degeneration, and the wet macular degeneration is defined as basically blood in the macula. And why does blood accumulate in the macula? So dry can become wet macular degeneration because basically when all of this drusen, this soft drusen, accumulates in the macular area, it destroys these cells there. It causes atrophy, And when your eyes are deprived of nutrition and oxygen, they send a signal to the brain, letting the brain know, hey, I need nutrients, I need oxygen, send something over. So then the brain starts the process called neovascularization, meaning new blood vessel growth. Now these new blood vessels are very weak, they're not as strong and sturdy as our original blood vessels, so they tend to break, they're very brittle, and 9 times out of 10 they will break, and then you'll have the wet macular degeneration, which is the blood spilling into the macular area. At that point you're going to have a lot of what we call geographic atrophy, because that blood then is causing more of the tissue around the area of the macula to atrophy. It destroys a lot of the tissues, so you'll see that big black spot in the middle. That's basically your vision after that point. When it's in dry stage, some people notice waviness. So if you're looking at a straight line, like if you're looking at a cabinet that's the top portion's going across, that looks like a straight line to all of us, but someone with macular degeneration, it would just be wavy. So it distorts your vision in that manner, basically, before it kind of takes away completely from that vision. Now with macular degeneration, it's only the central portion, so your periphery is still intact. So you'll see a lot of people who have macular degeneration, to see clearly, they might turn their head to look through the side to see anything that they need to in front of them. So if you see anybody doing a lot of this, that means they most likely don't have their central vision and they're using their periphery to see. So basically the risk factors for So the risk factors for macular degeneration. Now, number one reason you can get it, it's hereditary, it's genetic. Unfortunately, sometimes you just can't help it, and it's in your genes to get it. There's other factors, like if you're a smoker, it can make it a lot worse. If you're overweight, if you have any heart conditions, cardiovascular issues, uncontrolled blood pressure, even things like a long-time exposure to sunlight. Sunglasses are a very, very important thing for everyone in general, but definitely people who have macular degeneration, because UV light from the sun, it destroys those cells that are in the center of that macula. So, and especially someone who has macular degeneration, you're already susceptible to it, and it just makes you weaker. It makes that area of the eyes weaker. And then as far as just demographics goes, race, Caucasians are more likely to develop it versus African Americans or Hispanics. Things that you can do as far as treatment goes, now this is the very important part, there is no cure to macular degeneration. There's ways to, hey, if you've been diagnosed, this is what you can do to slow the progression down. This is what you can do to change your lifestyle, to function, to just kind of walk around, do all your daily activities. So what we recommend usually, once we notice macular degeneration, even if it's one pinpoint drusen, we start you on some vitamins that are meant for the eyes. I'm sure you've all gone to like a Walmart or Walgreens and you see all these vitamins for the eyes. And we usually a lot of people tend to just take it because they think it's healthy for them, but a lot of times it's really meant for people who have macular degeneration. That's when you start these things. If you don't have any signs of macular degeneration, and say it's, someone young comes into my office, oh, well, my grandmom had it or my mom has it, then I would say, well, at least take a multivitamin, because vitamins are very pertinent to the eyes. The vitamin A, E, it's very, very important. The other places that you can get these vitamins is through food. And foods like, is leafy green vegetables, all your bright vegetables like your red bell peppers, your carrots, your yellow bell peppers, tomatoes. They have a lot of antioxidants. And remember, antioxidants is what picks up that debris and that waste that's created and recycles it. And that's the, the main process of getting rid of that drusen. So nuts, legumes, blueberries, everything that has color to it actually has a lot of vitamins and antioxidants that helps with that. Omega-3s are very important, so anybody who likes seafood, definitely, all your fish, your salmon, those are healthy things that you can incorporate, and it has other benefits too, but definitely for the eyes, those are very important things to incorporate into your diet. Yes?
Would that mean that you would take krill?
Yes.
Okay.
Yeah, so, go ahead, I'm sorry.
No, because my GI specialist had not too long ago said that the studies weren't showing it any beneficial, but I think what he meant was for cholesterol.
Got
See?
you.
So it is important for me to know
Yes.
that I should continue it for another reason.
Yes, exactly, exactly.
You can eat the salmon, but you can't eat it every night.
You can, exactly.
And it's up in price now.
Yes, you're right. I think everything's up in price these days, but yes, it definitely is. So yes, helping yourself out with supplements, it's important. Of course, you have to let your regular doctor know. So a lot of these things, if you're taking a multivitamin and then you go take a Preservision or an Ocuvite, you might be doubling up on those vitamins, which is also not good for you. Too much of something is also not good. So it's very important to let your PCP know so they can kind of regulate you and say, okay, well, stop the multivitamin if you're taking the eye vitamins. So, constantly being in touch with your PCP, as eye care professionals, being in touch with the PCPs is very important to make sure that whatever medications you're taking is not contradicting what we're recommending for you guys. So that's the treatment for dry macular degeneration, and that's like the first stage, something that's a little bit more manageable. When it gets to wet, when you have those new blood vessels growing, there's two forms of therapy that they're doing. The first form is called Pdt Photodynamic Therapy. Not used so much anymore, but they still, some ophthalmologists still try to go that route. And what they're doing with that therapy is, if you look at, I'm not sure why the image is not showing up here, but if you look at your... Yes, so it's laser therapy. So what they're doing, first they do an angiography of the eyes, right? They put the dye in, they see what everything looks like. If you look at your sheets there, that black and white picture, there's arrows where there's new blood vessel growth. I know it's pretty tiny, sorry, but there's new blood vessel growth there. And that's exactly where they trigger the laser. So then what they do is they're kind of like cauterizing it. So they close up that blood vessel so it's not continuing to grow like a tree branch. And so it kills off all these new blood vessels so they don't even get to the point of leaking and causing more vision loss. The other way of controlling it is the anti-VEGF therapy. So these are injections that you can get. Lucentis and Avastin have been around for many, many years. Eylea is a pretty new one, and I believe Avastin was actually used as a cancer treatment as well. But it's, again, same concept, it's just an injection, it's more localized. They can kind of get to the source of where the blood vessels are, and it stops new blood vessel growth. So whereas the photodynamic therapy, you have to see the new blood vessel growth and cauterize it, the anti-VEGF injections actually stops it from growing. So it hits it a little sooner than the photodynamic therapy would. So those are the two things right now that they have out there. The other potential new dry macular degeneration treatments that they have that they're currently doing studies on. They were very, very close with the Oracea. It's an oral antibiotic, an anti-inflammatory. They were in stage 3, I believe last year. They were supposed to come out with it beginning of this year, but of course last year was, not so great. So people were focusing on coming out with a vaccine. So I believe that's delayed a little bit, but it's an oral medication. I mean, imagine going to the doctor and getting an injection in your eyes. I think people would rather do the oral route. Oral medication that actually helps control the inflammation. So there isn't that drusen there that causes the vision loss. So they are doing studies on that, and then metformin, which is, I mean, it's been around forever, it's a diabetic medication. Who knew that also had anti-inflammatory ways of kind of lowering the risk of development. So again, very important, it doesn't stop it from occurring, but it slows down the progression of the AMD and then controls the severity of it. So it doesn't get to the severe stages, you're looking more at mild or moderate stages. So yeah, that was macular degeneration in a nutshell. So, you guys have any questions for me?
I do.
Yes.
Why would you get it like in one eye and not the other?
There is no rhyme or reason. We call it idiopathic, where it's like it just chooses an eye. But 9 times out of 10, if you have it in one, you most likely get it in the other. But it's rare to have it in one, but you can. Yeah, it just picks an eye. Yeah. Yeah, some things are just not, you know. Any other questions?
At what age do they normally, your youngest patient,
Mm-hmm.
who develop?
Macular degeneration, good question. So, usually we see it late 50s into 60s, that's when we
Okay.
start seeing it. That's not to say I haven't seen patients in their 40s have it, but that is a rare situation. So usually you end up seeing it, and you see, and it starts off very, very minor, very slow, and then you see it progress over time.
I think in our field we see some of the other things too. I have a gentleman that's in his 60s, and he has diabetic retinopathy,
Okay,
and it significantly has damaged
yeah,
his eyes.
yeah.
I think also glaucoma.
Glaucoma, you see, I'm sure you guys
Mhm.
see a lot of that, yeah.
So, and it's very important that they take their drops correctly.
Yes.
You know.
Compliance, believe it or not, is a huge reason why we see it progress. Because a lot of, especially the older patients, sometimes they just forget, or they don't even, they don't remember. It could go, I had a patient who let 3 months go by, he didn't get his refills, and he was like, oh wait, I was supposed to get refills for that? Like, just didn't realize he was supposed to take the drop every day, and it progressed, so.
I encourage our team to be educators, so the more they're reminded and they learn,
Yeah,
they say
of course.
something,
yes.
which is then very beneficial for everybody. I think when I had the stroke behind my eye in 2008, it was totally caught me off guard.
Mm-hmm,
And right away, the ophthalmologist said it was high blood pressure.
yeah.
And that was just not something I thought was in the scope of things.
Right.
So it was laser treatments, it was Avestin in the beginning, and then it is a retinologist,
Yep.
yeah. So, and when you mentioned about the vitamins, I had to do, I did a little research, because the fact is they want the zinc, the more expensive AREDS, AREDS.
Yes, the iris.
They want you to buy your eye vitamins. The zinc, 11 milligrams, actually is in my multivitamin.
Right,
And I asked the pharmacist, and she said you really shouldn't take more than that,
exactly.
see? So
That's
I was
why-
glad
Mhm.
you mentioned how important it is to talk with your doctor about other medications that you could be on, because otherwise, we need all the help we can get. I might have just gone out and, because they gave me a sample. And then the other thing is the lutein, 20 milligrams.
Yep.
You can get that extremely reasonably at Walmart,
Yep.
and just add it.
Add
To your
it,
multivite
exactly.
that is extremely reasonable.
Yes.
Yeah.
Yes,
So.
it's, the treatments can get pretty, especially the supplements, it can get costly, especially the name brand stuff. So if you can find it separately, the zinc, the zeaxanthin, you can find separately, like those things, you can definitely, take it in conjunction, just make sure it's the right milligrams.
Yeah.
If somebody what you're talking about, how much times for the year do they see their eye doctor?
So it depends. If it's the dry kind, I'm usually seeing patients every 6 months. If it's the wet kind, the ophthalmologists are usually seeing them every 3 months.
And with the glaucoma too, they're always checking on us because of the pressure.
Because of the pressure, yes. And that, with everything, it always varies. Some people just tend to progress quickly, some people don't. You'll see them over 5 years and the same drusen's there and it's not moving and it's not causing any additional vision loss. But another person same age, they can have like 5 more drusen, when they come back in 3 months, so.
I think what a lot of you see are the lubricating drops.
Mm-hmm.
A lot of our people being older with dry eye.
Mm-hmm.
And they're over the counter.
Yes.
So I mean, if we're washing our hands and we have our gloves on, we can assist if they need
Oh,
it.
yes, definitely.
But again, that can be very helpful.
Yes. Dryness is very, very prevalent. And dry eye drops, the over-the-counter ones, can be used up to 4 times a day. Anything after that is not going to really, you're not going to find any benefits from it. So just like something that you should know, like, a lot of people are just, they're using it like every hour. And it's like after the 4 times, it's not doing anything
They
for
do,
you. So.
compulsive.
And you want to space them out too because your eyes are being used. You use it in the morning, you want to wait a couple of hours after your eyes have been used, or constantly these days, we're all staring at a computer, phone, and that dries your eyes out even more. So it's important to space the drops out too.
I think one of the things I found from experience is that when they added the dorsalamide to the timolol, it burns.
Yes.
Now it doesn't burn, like, it goes away.
There's
but
initial stinging, yes.
that can be something that for an older person, if their eyes are even drier, maybe it hurts even longer.
It does. It does. So when your eyes are drier, you don't have the tear film there to protect your eyes and the surface of the cornea. And the cornea is very sensitive, so sensitive to touch as well. So anything that goes straight to the cornea doesn't have that tear film as a barrier, it's going to sting a lot more. Yeah.
Yes, thank you all for coming. And I said that flowers are for us